Hello, everybody. I am Jayme Simões, and I'm talking to you from Concord, New Hampshire, and I'm here on behalf of Protect Our Care, New Hampshire. It's nice to have everybody join us today, and we're very honored to be joined by Representative Maggie Goodlander. First, let me tell you that what we're going to talk about is what's happening in Congress, where Congress is debating a proposed federal budget that includes the largest cuts to Medicaid and the Affordable Care Act in our nation's history. And that will be the theme of our conversation. First, I want to welcome Representative Maggie Goodlander. She represents New Hampshire's 2nd District, and she was born and raised in Nashua, a city that her family has called home for more than a century. Wow, it's so nice to meet you. Thank you for all you've done. It's nice to have you on. And I hope you're well. I assume you're in Washington and the weather's a little bit nicer there than it is here.
It's good to be with you, John. You're making me homesick, though.
Well, thank you. Well, we're going to go through a series of questions, and feel free to add anything that I might be forgetting. And the topic is a very important one to New Hampshire residents. But what are you hearing from your constituents about concerns over these cuts to healthcare, including Medicaid expansion, and of course the enhanced premium tax credits? How do you think these programs and the reduction to rural healthcare access with these cuts are going to impact New Hampshire?
John, everywhere I go, all across our state, this is an issue that I hear um, from constituents about the deep concern, and I have no higher priority right now than to protect the healthcare that tens of thousands of people across our state, millions across our country rely on. And as you said, HR 1, the GOP tax break bill, which includes the biggest cuts to healthcare in American history. It would be the biggest deficit increase in American history. And why? Why are we making these cuts and jacking up our debt and deficit? It is to fund the biggest tax breaks for billionaires and big corporations that we've seen in a generation. And look, these are big numbers. These are big numbers, but what I see every day in my job are the human faces and the toll that this is going to take on literally the lives of millions of people in our country. You know, we voted on HR 1 in the dead of night here in the House of Representatives. It was over the course of 2 all-nighters. We had a lot of time on the House floor, and I used that time to go to my colleagues, my Republican colleagues, and to make the case against this bill because I think that there's a lot of misunderstanding among many people. Some of good faith misunderstanding, some bad faith, straight up misrepresentations about who Medicaid serves in particular, because these are the biggest cuts to Medicaid in American history. But I brought the stories, the real human stories of the people who I'm so proud to represent to my colleagues. Human faces, people who, but for Medicaid, but for the Affordable Care Act premium tax credits, they wouldn't be alive today. Their lives depended on this care. And that's what we're talking about. And whether you're talking to families who are navigating the challenges of raising a child with disabilities who relies on Medicaid, and I have met so many extraordinary people in our state who rely on Medicaid, who wouldn't be here but for Medicaid, whether it's the childbirths, which more than 40% of childbirths in this country depend on Medicaid. It's also what I've heard from our healthcare providers who speak to the systemic impact. And they use 2 words. Really, it's across the board 2 words: devastating and catastrophic. And that is because these cuts are going to put so much strain on an already strained, particularly rural healthcare system. And in our district, which is 6,500 square miles from my hometown Nashua all the way up to the North Country, it's a mostly rural district where we have so many extraordinary, hardworking healthcare providers who are operating on razor thin margins, who are giving their all to keep their operations up and running. We have critical access hospitals that are going to be put under stress like we've never seen before. Last week I was in Claremont at Valley Regional Hospital, an extraordinary place that provides care to people all across Sullivan County. This is a hospital that is already under so much stress. These cuts are going to be devastating, and we're going to have to do everything we can to keep the doors open. But this is what I'm hearing, John, really from hardworking people whose lives are on the line, and from hardworking healthcare providers who are desperate to be sure that they can provide the care that so many people in our state rely on.
Well, thank you. Thank you for that. I also want to welcome and recognize that we've got a couple of our friends and colleagues on this call from the media, and we'll give them a chance at the end to ask any questions. Based on what you said, I've been reading a lot that's being written about this big, beautiful budget, and a lot of healthcare policies are very concerned that these federal cuts, as you just mentioned, would decimate rural healthcare, particularly forcing community hospitals like Cheshire Medical to close their doors, and that, as you know, would only take something that's already in difficult in New Hampshire and make it a lot more difficult. What would these cuts mean for New Hampshire, particularly in rural areas, which you represent? And how do you plan to respond, against this proposal that could throw thousands of Granite Staters off of their health insurance?
Our our critical access hospitals, our rural hospitals are a lifeline for communities across New Hampshire and across our country. They provide healthcare, they keep families afloat. They're extraordinary pillars in our communities. And in my visits all across the district, they are, like I said, it's two words, devastating and catastrophic, that they use to describe what these cuts will do. A lot of the challenge is going to come in, we're in a moment when I'm trying to find common ground with anyone who really wants to take on waste, fraud, and abuse. That is my own view, is that our democracy really depends on people having faith and trust that government is really going to deliver and be able to do the job. And the fact is that this bill, HR1, is going to introduce so much more red tape, so much more waste into the system for people who are simply trying to get access to the care that they need. The hurdles that hardworking people face to, in the first instance, establish eligibility in Medicaid are huge. I was last week talking to a navigator who works at a critical access hospital and helps people across our state navigate the process of enrolling in Medicaid. And that is God's work. It is so difficult to navigate these processes already. And one of the concerns with HR1 is that it's a deluge of additional red tape at a moment when we should be laser focused on how we make these programs work more efficiently. When I hear from my colleagues in Congress who are arguing that this bill is really about cracking down on waste, fraud, and abuse, I came to Congress having worked at the Department of Justice in the Antitrust Division. And look, I see monopolies everywhere, but some of the most blatant and pernicious monopolies in America are in the healthcare industry, where we see massive corporations, some of the biggest corporations in the world, who are in former lives payers, or, actually recently I was speaking to a doctor up in the North Country, and I asked a question about a payer. He said, no, Maggie, payer is the wrong word. These are premium extractors and claim deniers. That's what we're talking about here. And that is the lived experience of millions of people across our country, myself included. Look, we spent a lot of time looking at the ways in which big corporations, some of the biggest in the world, are buying up every part of our healthcare industry, from insurance to actual provider practices to pharmacies. And what has been the impact? There has been massive fraud, massive waste, massive abuses of power that at the end of the day hurt hardworking people the most, and are driving so many extraordinary people out of our healthcare industry. Providers who simply cannot spend the time that they need to deliver care, they take an oath, a Hippocratic oath. And that oath is complicated every day by corporations who are putting doctors through an extraordinary ring to simply provide the care they need for their patients. And one of the things I'm eager to do in Congress, and the question I've been asking providers across our state, is if we started to see more transparency in the number of hours that doctors and healthcare providers spend fighting with insurance companies to try to actually do their job, I think we would find a huge, massive pattern and extraordinary evidence of waste, fraud, and abuse. At the Justice Department, we were focused on uncovering fraud in all its forms. And we saw a whole lot of it when it came to Medicare and Medicaid from big corporations. And you and I were talking about the CVS lawsuit, which I'm very encouraged that the state of New Hampshire has joined together with, I think, now more than 25 states across our country. It really goes to the core of what big monopolists are doing to abuse their power and to jack up costs by stealing taxpayer dollars.
Yeah, and I actually have a follow-up question based on that because that brings up a really good point. So thank you for mentioning it because often in Congress we hear people talking about so-called waste, fraud, and abuse at the individual level. But as you said, there are these large-scale corporate fraud cases like lawsuits against I think CVS, United Healthcare, Walgreens, suggesting that the real cost may indeed lie elsewhere. So how can Congress shift oversight and accountability efforts from scapegoating working families to investigating and preventing large-scale fraud by corporate bad actors? And what can be done at the federal level to ensure that Granite Staters aren't left footing the bill for corporate greed?
Well, look, when I worked in the Department of Justice, I enforced our antitrust laws and our consumer protection laws. These laws are rooted in ideas that are as old as America. The basic idea that, like any kind of power, corporate power has got to be checked. And these are laws that also have not been updated, in some cases in more than a century. I'm part of a really exciting caucus called the Monopoly Busters Caucus. We come from all parts of the country. We come to this work with different backgrounds, different districts, but all united by the basic idea that Congress has got to update outdated laws that are actually going to strengthen accountability and help us crack down on the most pernicious types of waste, fraud, and abuse, and that's corporate waste, fraud, and abuse. And alongside that, we're working together to really flex every oversight muscle that we can. I believe deeply in congressional oversight. I believe in it deeply because I've seen the difference that it can make in how the laws get enforced. And these days, we are relying heavily on state attorneys general who are stepping up. And I'm a part of a task force here in the House. For the first time ever, we've got a dedicated task force for tracking litigation all across the country, more than 200 cases. Most of these cases are really going to the core of abuses of power by the Trump administration across the board. And one of the first of those cases was filed in the state of New Hampshire, the birthright citizenship case on January 20th, right out of the gate. But this is, to me, the accountability that comes from Congress at its best is going to help us use all the tools to shine a light. I believe deeply that sunlight is one of the most powerful disinfectants in American democracy. To shine a light on this. And this is exactly what I felt so many of the cases that I worked on. They were really complicated cases in some ways. The healthcare cases that I worked on at the Justice Department. We had a really massive case focused on United Healthcare. We had a couple of those cases, but this is the thing about monopolies. There aren't very many of them, so they're easy to spot. At bottom, each of these cases is a case that could be generated from a congressional oversight investigation. And this is what I'm working with my colleagues on. I think that the most powerful voices are from people on the ground who are feeling the pain of corporate abuses of power, of monopoly power in the healthcare space. And we've got some good models from which to work. And I'm really eager to partner with you and with folks all across New Hampshire because at the end of the day, this is a bottom-up the change is going to have to come bottom up, especially at a moment when so much of the system as we knew, as we've known it is being burned down.
Representative Goodlander, thank you. This has been a really helpful and I think intense conversation about what you're doing, what we're facing, and some good ideas. And I want to ask my colleague Rachel to join us. She is going to reach out to our friends from the press who have joined us to see if they have any questions for you. Hi, Rachel.
Hi, Jayme, and thank you, Congresswoman Goodlander, for joining us today. For our press who have joined us on today's call, if you have any questions, you can please drop those questions in the Q&A box at the bottom of your screen, and I will be monitoring that. Yeah, if you have any questions towards any specific part of this conversation, please note that in your question. Now, our first question was submitted ahead of time, and that is, can you speak more? About what you're hearing from your constituents about concerns over cuts to healthcare, including Medicaid and ACA programs like Medicaid expansion and EPTCs, and how will this impact New Hampshire health long term?
Yeah, the day that we started deliberations on HR 1 here in the House, I had two extraordinary women who came from New Hampshire, and um, it has been for me an honor and a highlight in this job to see so many people who are stepping up, who are showing up, sometimes and often for the first time ever, coming to Congress to advocate, to make their case, to share their stories. And I was sitting with two extraordinary women who are both cancer survivors, who explained to me in detail why it is they wouldn't be alive but for the health care that they got. You know, one relied on Medicaid expansion on Granite Advantage in New Hampshire. Life hands you sometimes a very difficult hand to play. And this is why we have these programs, these safety net programs for a reason, to be there to catch, to support people in their hour of need. These two women shared their stories, and their stories are so powerful. And we shared a video, and I hope that all of your viewers today will take a look because these two stories, together with so many others, the thousands that we've collected over the last 6 months, speak directly to what these programs mean to people's lives and why these cuts are really putting human beings and futures on the chopping block. This is what gets me up every morning and keeps me in this fight. A group of 16 of my Republican colleagues wrote a letter this week expressing concern about Medicaid, and you better believe that I'm going to each and every one of them to make the case and to reinforce this, because the truth is we got the narrowest margin in a generation in the House. We lost this vote by one vote, and we've got to fight for every single one of them. And at the end of the day, it's going to be the stories of real people who are going to feel the real pain and whose lives are on the line because of this bill.
Thank you, Congresswoman Goodlander. We have another question today, and that is, there is a national and statewide shortage of primary care doctors with fewer medical students and residents going into primary care. And this journalist has heard from many patients who cannot get an appointment or have to wait months just to get an appointment. How can Congress help alleviate this shortage situation?
So to me, as I've traveled around New Hampshire, housing is an issue that comes up every time I'm visiting a critical access hospital or talking to healthcare providers who are trying to scale up their primary care operations. It really is true across the board in all areas of healthcare. Nursing staff is another area, but to me, the housing crisis that we're in the midst of in New Hampshire is at the root of the root of this core challenge. And one of the extraordinary things that we're seeing is the creativity that people around our state, as always, they find the creative solutions. We've got such a can-do community. When I was in Claremont last week at Valley Regional Hospital, it was a great day to be there because the hospital just opened up a new housing development that they built right on site using a federal grant through the Northern Border Regional Commission. Um, it's a relatively small, but it's already been materially helpful. It's made a massive difference in bringing 8 new providers who otherwise would not be working at the hospital today, but for this new housing development that opened up literally a week and a half ago. Leveraging federal dollars and creative partnerships wherever we can on housing. We know that we need to build 60,000 new homes in New Hampshire to meet the demand, and that may be an underestimate. But to me, again and again, what it comes back to is we've got hospitals, providers who are wanting to bring new providers back to New Hampshire are facing a fundamental challenge that they can't find a place to live. And so this is one, I think, really important piece that I'm very focused on. And look, housing for a long time, the United States Congress was out of the game. It was thought of as really a state and local issue. And there are huge aspects of it that are state and local issues, but Congress has resources that we can bring to the table. And I'm hugely focused on this, and it's going to take all of us. I think governing is a team sport, and that is so true when it comes to tackling our housing crisis.
Thank you. Now we have time for one more question today, and that is, if these Medicaid cuts pass, what can you and the congressional delegation do to mitigate the damage on the state and local level?
Well, look, that is first and foremost, my priority is to try to prevent this devastation, this catastrophe, to do whatever I possibly can between now and when the Senate votes again and when the bill comes back to the House. And I think, we're looking for every possible opening and crack of light that we can find. In this letter that I mentioned, 16 Republicans in the House who expressed real concern about Medicaid cuts. Some of these colleagues are names that I had not been at the top of my list. So this is priority number one. But Charlotte, your question about what can be done to mitigate the damage, I've been thinking a lot about battle damage assessments in the last 24 hours in a very different context, but we're going to have to see what this bill looks like, which provisions survive, and which ones the damage can be mitigated most. I mean, what we know is that this bill will almost certainly include, as I was saying before, additional red tape, additional hurdles that hardworking, eligible people in our state are going to have to navigate and cut through. We're going to need an army of bureaucratic ninjas who are going to be able to help people navigate this new red tape that's going to be introduced into the lives of people who shouldn't ever be expected to have to navigate this, but who are going to have to. And that is one of many areas where I certainly want to be engaged personally and use every tool that we can through Congress. But this is the fight of our lifetimes. And so for me, mission one is to do everything I possibly can to mitigate the damage in this bill on the front end.
Thank you, Representative Goodlander, for answering everyone's questions and having a great conversation with us today. That is all we have time for today, so I will turn it back to Jayme.
Thanks, Rachel, and thanks for your help today. Congresswoman Maggie Goodlander, thank you for joining us. It's great to have you doing what you're doing, where you're doing it. It's an important time for the people of New Hampshire and the 2nd Congressional District. Really appreciate your honesty and your directness today. And I also appreciate the members of the media who came and joined us on this conversation. So thank you. Thank you, Congresswoman Goodlander. Thank you, Rachel. Thank you, friend journalists. On behalf of Protect Our Care in New Hampshire, it's always a pleasure to talk about difficult things and try and work towards positive conclusions. So thank you.
Thank you all.
Take care. Goodbye, everybody. We'll see you soon.
Thank you.